Hey everyone, and welcome back to the channel. Today, we're diving into a topic that, believe it or not, is still incredibly relevant: the ever-changing landscape of COVID-19 symptoms. It feels like we've been talking about this for years, and we have, but the virus continues to evolve. And with it, the signs that tell us we might be sick. It's easy to become a bit complacent, to think we know all there is to know. But what if I told you that some of the most common symptoms right now are ones we might easily dismiss as just feeling a little run down? That's what we're going to unpack today. We'll look at the current symptom profile, why even mild signs matter, and how this virus's presentation has shifted over time. It's crucial information to keep ourselves, our families, and our communities safe. So, what should you be looking for right now? The list of symptoms has become both broader and, in some ways, more subtle. Let's start with the big one that almost everyone reports: fatigue. This isn't just your typical end-of-a-long-week tiredness. We're talking about a profound sense of exhaustion, a bone-deep weariness that can make even simple tasks feel like climbing a mountain. You might wake up feeling like you haven't slept at all. This kind of fatigue can be one of the very first signs, appearing even before a cough or fever. Next up is a sore throat. For many recent variants, a scratchy, painful, or irritated throat is a hallmark symptom. It often feels different from a typical cold-related sore throat. Some describe it as feeling like swallowing glass. It can be quite sharp and is frequently one of the initial indicators that something is off. So if you wake up with a sudden, unusually painful sore throat, it's definitely a reason to be cautious. Of course, the classic respiratory symptoms are still very much in the picture. A persistent cough, which can be dry or produce phlegm, remains a key sign. This isn't just a little tickle in your throat, it's often a cough that lingers and can be quite disruptive. Headaches are another major player. These aren't just minor tension headaches. They can be moderate to severe, often described as a pulsing or pressing sensation, and they don't always respond well to over-the-counter pain relievers. And while high fevers were a telltale sign early in the pandemic, a low-grade fever or even just feeling feverish and having chills can also indicate an infection. Shortness of breath is a symptom we always need to take very seriously. While it may be less common with some of the newer variants compared to the initial waves, any difficulty breathing, chest tightness, or inability to take a full deep breath is a sign to seek medical attention promptly. It's a reminder that while the virus may seem milder for many, it can still cause significant respiratory issues. Now, what about those classic symptoms that defined the early pandemic? Loss of smell or taste, also known as anosmia and ageusia, was once a dead giveaway for COVID-19. Interestingly, this symptom has become much less frequent with more recent variants. While it can still happen, it's no longer the reliable indicator it once was. This is a perfect example of how the virus has changed its typical presentation, which is why we can't rely on just one or two specific signs anymore. Here's the part that's so often missed and is arguably the most important message of this video: the impact of mild symptoms. It's so easy to have a little sniffle, a slight headache, or feel a bit more tired than usual and just brush it off. You think, oh, it's just allergies, or I just didn't sleep well. But with COVID-19, these seemingly minor issues can still mean you're infectious. This is where the real challenge lies. You might feel well enough to go to work, to meet up with friends, or to run errands. But during this time, you could be unknowingly spreading the virus to others. And for some people, especially those who are older, have underlying health conditions, or are immunocompromised. Even a mild infection can lead to serious complications. What feels like a simple cold to you could be a life-threatening illness for someone else. This is why our personal responsibility hasn't gone away. The idea that we need to power through when we feel slightly under the weather is outdated and, frankly, dangerous in the context of a highly transmissible virus. Paying attention to your body and taking even small symptoms seriously is an act of community care. Let's talk about the timeline. Symptoms don't all appear at once. You might start with a scratchy throat and fatigue one day. The next day you could develop a headache and a low-grade fever. A cough might not even start until day 3 or 4. This staggered onset can be confusing. It's essential to monitor how you're feeling over several days. If you notice a cluster of these symptoms emerging, even if they're mild, it's a strong signal to test and isolate. Keeping a simple log of your symptoms, what they are, when they started, and how severe they are can be incredibly helpful, both for your own awareness and if you need to speak with a healthcare provider. Another aspect we need to consider is that COVID-19 can sometimes look like other illnesses. Allergies, the common cold, the flu, strep throat, they all share overlapping symptoms. A runny nose, sneezing, and body aches can be caused by any of these. So, how can you tell the difference? The honest answer is, based on symptoms alone, it's almost impossible to be certain. This is why testing remains our most reliable tool. If you have any of these symptoms, especially if you know you've been exposed or there is a high level of transmission in your community, getting tested is the smartest and safest thing to do. It removes the guesswork and allows you to take the right steps to protect yourself and others. And what are those steps? If you test positive or have strong reason to believe you have COVID, following public health guidance is key. This typically means isolating yourself to prevent further spread. The recommended duration of isolation can change, so it is always a good idea to check the latest advice from your local public health authority or organizations like the CDC. During this time, focus on rest and hydration. Most people with mild to moderate illness can recover safely at home. Manage your symptoms with over-the-counter remedies for fever, pain, and cough. But always consult with a pharmacist or doctor if you're unsure what is safe for you to take. It's also crucial to monitor your symptoms for any signs of worsening. If you experience difficulty breathing, persistent pain or pressure in your chest, new confusion, or have pale, gray, or blue-colored skin, lips, or nail beds, you should seek emergency medical care immediately. Don't wait. It's always better to be safe and get checked out. I want to take a moment to touch on long COVID or post-COVID conditions. This is a really important part of the conversation for a significant number of people. The illness doesn't just end when the initial infection is over. Symptoms like debilitating fatigue, brain fog, shortness of breath, heart palpitations, and joint pain can persist for weeks, months, or even years. This can happen to anyone, regardless of whether their initial illness was severe or mild. In fact, many people with long COVID had very mild initial infections. This is another powerful reason to avoid getting infected in the first place. The potential long-term consequences are serious and can be life-altering. So, to wrap everything up, the main takeaway is to stay vigilant. The virus is still with us, and its symptoms have shifted. Pay close attention to fatigue, sore throat, cough, and headache. Don't dismiss mild symptoms. They can still indicate an infection, and you can still be contagious. When in doubt, test. It's the only way to know for sure. Follow public health guidelines on isolation to protect those around you. And please, be aware of the more severe symptoms that require immediate medical attention. Remember, this information is for educational purposes and is not a substitute for professional medical advice. Always consult with a healthcare provider for any health concerns or before making any decisions related to your health. Your doctor is your best resource for personalized guidance. Thank you so much for watching and for taking the time to stay informed. Taking these small steps to be aware and responsible makes a huge difference in the health of our entire community. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on health and wellness. Stay safe, take care of yourselves, and I'll see you in the next video.